So hello friends, welcome to my new video. So today in this video I'm going to discuss with you about a very important topic that we all should know, that is bacterial keratitis. Okay, so from this video you will understand the types of bacteria that are responsible for infection in cornea. Okay, so let's start. So actually keratitis means the inflammation of the cornea which is due to microbial infection, and this keratitis can be ulcerative or non-ulcerative. Okay, so keratitis can be characterized by the corneal edema, cellular infiltration, and ciliary congestion. As you can see in this picture, these are the ciliary, the cellular infiltration with epi defect is there, and also little bit congestion is also there in the conjunctival area. Okay, so this is keratitis. So an intact healthy corneal surface with a healthy tear film cannot be infected. Okay, so there should be some amount of surface disruption to get infected. So the best way to diagnose the infection is properly take the history of the patient, and a good slit lamp examination is very much important. There is some bacteria which can penetrate the intact corneal structure or corneal tight junction, and they are Neisseria gonorrhoeae, Cornybacterium diphtheria, and Neisseria meningitis. Okay. So as I describe in this picture, these are the cellular infiltration with epi defect is there. So in slit lamp finding, you will write that in cornea there is infiltration with epi defect. Okay, and in conjunctival area you will write congestion. Okay, and if you examine, then if there is any edema present in the eyelid, then you can also write it there. Okay. Another thing is that there is two type of bacteria, gram positive and gram negative. As you can see in this list, as these are the gram positive bacteria, staphylococcus, streptococcus, nocardia, cornybacterium, etc. And these are the gram negative bacteria, pseudomonas, Neisseria morosella, and haemophilus. Okay, if you want, then take a screenshot of this picture so that you can memorize this properly. Now if we discuss about the risk factor of this type of corneal infection, so first of all, trauma. If the eye have any trauma there or foreign body, then it can lead to some infection in the corneal surface. Okay, contact lens wearer, if the person do not maintain the proper hygiene while wearing the contact lens, then he may at risk of having this type of corneal surface infections. Dry eye, like dry eye, why? Because in dry eye there is deficiency of tear film in the ocular surface. So this deficiency of tear film leads to less amount of uh, immune response to the infection, because we all know that the tear film help to prevent any type of infection to the ocular surface. So due to lack of tear film, there is microorganism get chance to infect the cornea. Okay, misdirected eyelashes, like inward directed eyelash, if it rub the cornea continuously, then it can disrupt the ocular surface and it may lead to surface infection. And contaminated with sorry, contact with contaminated water. Suppose the person washed his face with a with the contaminated water, then if the water in anyhow reach to the eye, then it can lead to certain infection to the cornea. Steroid in drug intake or diabetes, why? Because the person who is taking steroid medication or who is having diabetes, they have weaker immune response or immune system than the normal people. So due to this weak immune system, those person have more prone to have this type of infection. Okay, so what are the symptoms? Before discussing about the symptoms, I would like to discuss these are the steps mm, of infection in bacterial keratitis. Okay, so what are those steps? First of all, there will be a cellular infiltration will there. What is mean by infiltration? So infiltration of lymphocyte into the epithelium and underlying stroma. Then it leads to active ulceration. So in the active ulceration, slugging of the epithelium and Bowman membrane is seen along with hyperemia of the circumcorneal vessels. So it lead to exudation into the anterior chamber, and that form the hypopyon and bacterial keratitis. In bacterial keratitis, actually hypopyon is sterile, but in fungal keratitis it is not sterile. Okay, so and the next stage is regression. So regression, in this stage, our body try to repair the defect, and digestion of the necrotic tissue along with the formation of dense margin along the ulcer, and with that formation of dense margin, there will be vascularization can also be seen. And in the last stage, that is cicatrization, It means the healing that will lead to healing of the corneal surface within that where there is proper reforming of the epithelium. So it leads to scar formation on the corneal surface starting from nebula, macula, leucoma, depending on the density of that corneal structures. Okay, so now let we move to symptoms of this keratitis. So here symptoms mean what the patient will feel, and sign means what you will examine, okay, or what we will see. So in symptom the patient will complain like acute pain and redness, lacrimation, etc., along with photophobia, reduced visual acuity, and white spot on the cornea. This type of complaint the patient will complain to you, okay. And after performing the slit lamp examination, you will find that epi defect will infiltrate. So epi defect you can see epi defect by fluorescent staining, and infiltrate you can easily understand what is infiltrate. And then stromal edema, chemiosis, then eyelid edema that I already told you, and subsequent scarring is that is seen in the cicatrization. So if we see the scarring peripherally and infiltration centrally, then you can understand that it is the ulcer or the keratitis is regression in mode, okay. And reduced corneal sensation is also there because the nerves endings are also affected in this. So you can see these are the infiltration with epi defect also there, and formation of hypopyon. So this hypopyon formed in this bacterial keratitis is actually sterile, okay, because those bacteria they are not reaching to this hypopyon area, so they are sterile and movable, okay. So in this picture you can see there is BCL also placed, and there is infiltration is also present. So what happened to this eye, that corneal scraping is done for the investigation and to find out what type of microorganism that is responsible for this infection. And along with that you can see this is hyperemia is there, and chemiosis of conjunctiva is there, and you can see the vascularization also coming, okay. So this is a severe form of this bacterial keratitis. It can be pseudomonas infection, okay. And another thing is that I remember that if the person is having purulent conjunctivitis, which is due to Neisseria gonorrhoeae, then that person may have chance to lead bacterial keratitis. As we all know that Neisseria gonorrhoeae can penetrate the cornea also, so it can lead to corneal infection also, okay. So this is the how the corneal scraping is done to take the sample for the gram staining, okay. So these are the cultures where those samples will be given to see the growth, okay. And in this picture also you can see these are the infiltration, chemiosis. So what is the treatment? So treatment actually antibiotic medication, as it is bacterial infection. So why bacterial infection only? Because it is find in investigation where gram staining is done, and after that investigation or the selection of what type of microorganism it is which is infecting the cornea is done. And if it is find that the microorganism is a bacteria, then antibiotic medication is started. Along with that antibiotic medication, steroid medication is also started to reduce the inflammation of the cornea, and systemic antibiotic should be given in Neisseria gonorrhoeae cases where systemic can also lead to this type of infection, okay. So that's all friends, thanks for watching. Please don't forget to like my video, subscribe to my channel, and please don't forget to hit the bell icon so that you will get notification whenever I upload any new video. And I hope from this video you get to know something about corneal infection, that is bacterial keratitis, okay. So in the next video I will upload fungal keratitis, okay. So thank you so much.